A watery eye is a common complaint among patients visiting the eye doctor. This condition affects all age groups due to different reasons, varying from simple allergy to serious problems like blocked tear drainage pathway called as dacryocystitis. Let's see about this in today's video. Hello, this is Dr. Kalpana Suresh, Medical Director and Chief Ophthalmic Surgeon from Kalpana Eye Care Hospital, Chennai. Tears are secreted from the lacrimal gland, which are located underneath the upper eyelids over here. Once they are secreted, they lubricate the entire eye surface with each blink and drain out of your eyes through the small holes located one in the upper lid, one in the lower lid called as puncta. Then it drains through the lacrimal sac and tear duct called nasolacrimal duct into the back of the nose. When this drainage pathway is blocked, tears cannot drain out of the eyes. As a result, the tears build up in the eyes, making them very watery. Bacteria grows in the stagnant tears and cause infection. This condition is called as dacryocystitis. This is common in newborns, young children and older people. What are the causes? The block can be caused by aging, which is a common cause. As we get older, the tear duct opening may get narrower. It can also be due to inflammation, eye injury, a broken nose, growth inside the nose or tumors very rarely. In some cases, newborn babies may be born with unopened tear ducts. This is called as congenital dacryocystitis. Once the drainage duct is blocked, the patients will have lot of tears or discharge from the eyes, pain, redness, swelling near the inner corner of the eye where the tear ducts are located. If severe, infection can spread to the side of the face too, more so if the patient has uncontrolled diabetes. A watery eye may significantly affect the patient's quality of life as it may cause social embarrassment and interfere with daily activities such as reading and driving. It may also cause chronic irritation of the periorbital skin due to repeated wiping away of the tears and the interaction of the salty tears on the skin. It can lead on to eye infections like corneal ulcer. Hence, it must be treated at the earliest. The exact treatment depends upon the cause of blockage. Basically, medications are given to treat the infection first. Once the infection is controlled, we can plan for surgical procedure. In newborn babies and young children, the block will be very thin and flimsy like a cobweb. This thin blockage can be opened by a special tear duct massage, mainly for babies. So the massage can be continued until 1 year of age. If the child does not respond to this massage therapy, probing can be done. What is probing? This is an interventional procedure done under general anesthesia in which a very fine wire is passed through the nasolacrimal duct to open the block. This procedure is done only in children. In adults, DCR surgery is commonly performed. DCR means dacryocystorhinostomy. It is the only way to treat the tear duct block completely since medications may only treat the underlying infection without fixing the block. The surgery bypasses the blocked duct, usually by removing a small portion of nearby bone over here. It allows the tears to drain directly from the lacrimal sac into the nose by bypassing the nasolacrimal duct. Wide drainage pathway prevents you from getting infections in the future. During the surgery, you will be given an anesthetic, so you won't feel any pain. There are two main types of DCR, namely external and laser DCR. External DCR is when the surgeon makes an incision near the swelling on the side of your nose. A small tube may be inserted to connect the tear duct to the nose cavity after removing a small portion of the bone. The wound is then sealed with few stitches. In laser DCR, a very thin tube is passed through the blocked opening of the tear duct until it reaches the bone between the tear duct and the nose. A tiny wire is passed through this tube. Once the wire reaches the bone, a strong laser is turned on. This laser cuts through the bone, creating a new opening for the tear duct. In this type of surgery, there is no external wound or stitches. If the lacrimal sac is extremely damaged, DCT surgery is performed by removing the entire lacrimal sac. The patient will continue to have excess tears after the DCT surgery, but it will settle after some time. Both the surgeries have pros and cons. Your eye surgeon will decide which would best suit you. Suppose if the patient has both tear duct block and cataract, DCR surgery to clear the tear duct block should be done before the cataract surgery. Performing cataract surgery in the presence of tear duct block would lead to serious infection after surgery called as endophthalmitis. This might result in losing sight or even the eye. Hope you had a clear idea about what is blocked tear duct and how it's managed. Thank you for your constant support. Have a nice day ahead.